Hey guys, you want to hit that door?
Yep.
It's Bob with Revive Proactive Medicine today, and the topic is the different types of hormones, the different types of testosterones. A lot of people came and they asked me about different things, and then I realized, being in the pharmaceutical industry and my family owning a pharmacy, you get to hear a lot about black market medication, the availability of it, and so forth. And there are really a lot of pitfalls that people need to be aware of. But there were questions people asked about specific hormones like testosterone, the different types of testosterone. And I wanted to touch upon them because testosterone in of itself, women and men produce testosterone. Men obviously make it through their adrenals, their testes, and so forth. Women also through their ovaries and their adrenals also. It's an essential hormone. It's obviously considered a male sex hormone, but it's a sex hormone that helps cellular metabolism occur, and it gives you obviously sex drive, endurance, stamina, helps you recover, and so forth. That's why it's a lot of as you're younger, you have produced more. As you're growing, it helps recovery, connective tissue, muscle, and so forth grow. Now, when people usually take it, it can be suspended in water, different types of oils or esters that determine how fast it gets into your body. It can be put in transdermals, in other words, creams or gels. Creams are like oil-based creams that you'd rub into your skin, and it goes transdermally through your skin. A gel, it's alcohol-based gels, just the same thing. Androgel is the big one that's marketed right now for low T. And men and women both can use them, and you can use them in higher and lower densities. And what determines the effectiveness is how much free testosterone gets in your system. And the issue is that a lot of doctors will take a look at your total testosterone and not the bioavailable or free. Free is unbound, and that's what works in your system. So we want to look at, obviously, the free portion along with the total. And then what we have to look at, that a lot of doctors and a lot of clinics don't look at, are the antagonistic hormones, the hormones that block the free or interfere or bind to the free. Although you're taking a certain dosage, you're not getting the bioavailable or the positive effect from that hormone. So the big culprit most people associate with interference is the association of too much estrogen in the system, especially for men. Men, as they grow older, produce or convert more estrogen that slows down and binds to free testosterone and interferes it. There are others, though. If you're under a lot of stress, cortisol does it. So people under a lot of stress, they don't sleep, they produce a lot of cortisol. Guess what? It interferes with free testosterone. A lot of lab work doesn't look at cortisol levels. And cortisol levels goes up and down during the day. But if you're under a lot of stress, you're not sleeping right and so forth, you tend to be more prone or cortisol dominant. You could be estrogen dominant, depending on if you're male or female. That's going to interfere. There's sex hormone binding globulin. There's another one, SHGB. A lot of doctors are like, well, what? Doctors, I don't test for that. Of course. Well, if that's out of ratio with free testosterone and cortisol and estrogen, guess what? You can treat somebody with testosterone, and all you're doing is exacerbating the issue. So when it comes to treatment, what types of testosterone? There's traditional testosterone cypionate, there's testosterone enanthate, there's testosterone suspension in water, testosterone propionate. All these medications are fundamentally a testosterone based in something that goes into your muscle and is slowly released or quickly released. The esters and so forth that they're bound to determine how they get back into your system. If it's a cream or transdermal, it's suspended in a cream or a gel, put it on the skin, and it goes through the skin. There's pros and cons to that too. And then orally. Alkylated testosterones, sublingual testosterones, they're effective, but when you're taking anything orally, we have to take a look at the impact it does on, with any of the medications, we have to do follow-up blood work to see if there's any impact internally with your liver and so forth. So what are the pros and cons? Injection, it goes right into your system. It seats itself in the muscle and determining what type, it slowly goes back into your system, so you have a steady increase of testosterone in your system. The creams, transdermals, goes through your skin. There's pros and cons. Some people get irritations from skin, from the rashes from the creams and so forth, and the transfer rate is low. It can be mitigated if you have oily skin. If you sweat a lot, it comes off in your clothes. You got to be careful around loved ones. You hug your wife or your baby, and this stuff's not fully transferred, and you're putting it on your arms. There are cases where you have children getting the transfer rate. So those in the sublinguals, I think we just covered that in the beginning. There's one other newer form that a lot of people are looking at are the pellets that are injected into your body, and sometimes they're coupled with estrogen blockers or estrogen control mechanisms. The issue is fine-tuning dosage. So if we put a couple pellets based on your physiology and your blood work, and your dosage goes up, but you're still symptomatic, it's hard to adjust dosage. So we got to bring it back in and do an invasive procedure. We have to cut you open, put more pellets in. So, and people metabolize them at different rates. So people will say, oh, they're good for 4 to 6 months. I haven't seen one case in, I'm not going to say 16 years, but in the last 5 years where they're really saying that these pellets are really effective, that they're effective for the length of time. Usually they run out a little bit quicker than the prescribing physician tells. So it's 4 to 6 months. Usually you're looking at the long side 4 months. So you got to get back in, you got to get that procedure done. But once they're in, you can forget about them if they're dosed properly. The issue is I have too many patients that come see our doctors and say, you know what, I'm supposed to get my pellets taken out in 6 weeks, but you know what, we check their levels and they're low again. In other words, the body has metabolized the pellet. So until they perfect that, I think the jury's still out on that. Creams and so forth work well with the majority of people that take them. The injectable is very effective. And see, all these you can affect dosage, so you can fine-tune the treatment. And that's the other thing too. We look in blood work primarily to see if you have any estrogen dominance, cortisol dominance, and so forth. And we take a look at these things. So proactively, we can use the appropriate estrogen or cortisol control or the SHGB control mechanisms along with the testosterone, so you won't react or have a negative reaction, or the therapy is effective for you. So rather than wait for nipple sensitivity or water retention, we want to make sure that we do an effective anti-estrogen or SHGB control or cortisol control before they become a problem. Patients come here with a problem, let's not give them something and they feel good for 6 months, then all of a sudden they come back. What happens with a lot of patients, they'll come to us from another clinic and everything worked fine for the first 6 months. These medications are like any other medication. You can build a tolerance to them. There are ancillary things that happen along with testosterone conversion that happens. So the testosterone goes up in your system, you feel great. That's the free testosterone initially. But also the other hormones that we just spoke about, the estrogen, sex hormone, binding globulin, cortisol, they creep up also in ratio to the free testosterone, and they can grow even quicker. So if we don't take care of those, they'll catch up, and all of a sudden we lose all the benefits from testosterone or hormone therapy, whatever you may be taking. So what we want to do is proactively, based on your individual characteristics, is keep the ratio apart. And in this space here, it's free testosterone. That's the magic. That's what makes the energy, the sex drive, the recovery, the cognitive function, all those things work beautifully. So what do? What do we use? Just use anti-estrogens and cortisol things? No, we use things that keep your dosage. The doctor will say, you know what, we can keep dosages very low, but the free testosterone very high by using precursors. They call simple things like methylated DHEA, pregnenolone. They stimulate neurological function, they keep you wide awake and so forth, but they also optimize free testosterone also. So a low dose, people come to me and go, well, I take a higher dose than that. And we just say, you know what, based on your blood work, if we keep these things low and we use these potentiators along with your testosterone, guess what? You have the equivalent of taking probably an extra 200 or 300 milligrams of testosterone, but you're not. You just freed up a bigger percentage of testosterone. People say, wow. Whereas in the black market, what do they tell you? More is better. So you feel good. Within 6 months, it's no longer effective, so it goes from 200 milligrams to 400 milligrams to 600 milligrams to 1,000 milligrams to 2,000 milligrams. Here's the issue. Every time you increase that dosage, your risk for negative side effects goes up, quantifies. And what happens now you have to contend with gynecomastia, cardiovascular disease, blood pressure issues, acne, hair loss. These are the things that will chase you and have given hormone replacement therapy a bad reputation. The other thing about the black market, since we're talking about black market stuff now, is when people get stuff and it's not from this country, there's no governmental agency. We don't know what you're getting. There was an article in the New York Times 6-7 years ago where they went out and they bought things online. They spent about $6,000-7,000. Half of it never showed up. The other half showed up. Some of it was actually medication, but when they tested it, most people would say, oh, it's probably all watered down. Well, some of it was, but some of it was supercharged. In other words, they had a testosterone that said 250 milligrams, but when they sent it out to the labs for efficacy, it wasn't 250 milligrams. It was like 600 milligrams. Well, guess what? If you think you're only taking 200 milligrams, you say, well, maybe I should take more. And you're self-medicating yourself without any medical supervision, that you take 2 or 3 cc's of that stuff a week. Now all of a sudden you're taking 1,000 milligrams, but you're under the impression you're only taking what? 300 or 400 milligrams? You've taken triple the amount, triple the side effect risk. There's your issue there. Contamination, sterility. Those are other things that people don't realize. They think because it comes in a nice box with a hologram on it, it looks professional. I can assure you, my family, we own a pharmacy, a compounding pharmacy in America. And I'll tell you, the scrutiny, the efficacy, the governmental agencies that look at compounding pharmacies is unparalleled. Bigger than the big name pharmas, okay? The little guys get, 4-hour inspections are not uncommon. 2-day inspections aren't uncommon. And I'll tell you something. You're looking at how these medications, I'll give you a snapshot of how it's all done. When we mix up testosterone in the pharmacies, and the pharmacists are making testosterone, it's made in either one or the other. It's called a positive pressure or negative pressure clean room. It's a very high-tech sterile room. And the tech or the pharmacist suits up in a separate room, then goes into the clean room, and then there's an ionization board that looks like something out of a kitchen, but this thing basically is one of the most sterile areas you can get. So I'll explain really quickly because I know it's really boring, is that the positive pressure clean room, there's actually a HEPA filtration that's hooked up 24/7, and if power goes down, it's backed up by a generator that drives HEPA clean air through the clean room and cleans the air that way. Then the negative pressure room, they're all, it's the big glass rooms, and the negative pressure is just that. Negative pressure is like a vacuumed, it's vacuum cup. So when you shut that door, nothing gets in. Okay, so whether determining on what kind of medication it is, you start off going into that room by dressing up with the respirator and the hood and the whole suit. You go into that clean room. Now, basically what that room does, the room that you're sitting in right now, the particulate matter in this room, for instance, or any average room, is about between 1,500 and 2,500 particulars in the air. Tiny, microscopic, inorganic, organic things that just float around, bacteria, everything that's in the air. You're always breathing interior-wise somewhere between 1,500 and 2,500 particulates in the air. When you go into one of these clean rooms, it drops it from, say, 2,000, 2,500 to about 200 particulate parts. So it's very clean. It sucks out a lot of the things. So the mixing actually doesn't occur there. The mixing in the pouring, the pharmacist takes it into this hooded place where they stick their arms through. Okay, it looks like kind of like a baby incubator, but it's all stainless steel. That's the ionization board, and that's where they actually put the medications into sterile vials that have been baked for a certain amount of time, that are certified. They're not just taken out of a package. These things have to be sterile and autoclaved, and then those are brought in, and within this ionization board environment, the particulate matter goes from 200 or 250 parts particulates down to about 2 parts. It's sterile. There's nothing in there. And the reason why that's so important, obviously, is because you're injecting this stuff through the major immune organ on your body. It's your skin. Once something penetrates through your skin, you're really vulnerable now. You don't want anything other than the medication into your skin. Same with transdermals. The medication's got to go on your skin and go through. Same with when you eat it. When you take something orally, you're counting on your digestive system to metabolize it, and the acids, that can help. But fundamentally is you can get sick if something is not compounded or not made in a sterile environment. And this is the most sterile environment you can get in, and it's regulated incredibly, and it's regulated right here. People are coming in on a regular basis, checking everything from chain of command, where that medication comes from, where it goes to, how it's handled, to the containment vessels, to the rooms. Everything has to be the spec, and it has to be done by the letter of pharmaceutical law on the state level and the federal level. That you're always, in any upgrades, there's no grandfathering in anything when it comes to pharmaceuticals. If there's a $75,000 piece of equipment that needs to be upgraded and you got to get it, you have to get it. And we just did it. The pharmacy just did it. I'll bring you over to the pharmacies in the future, and you'll see what these clean rooms. It's high tech. It looks like something out of a science fiction movie, but you know what? It has to be done. And when you think about that, there's a value to there. There's a cost there, obviously. And you know what? That's the reason. That's the peace of mind people look for when they come to a clinic. They're getting medically supervised. They're seeing a doctor that has experience in not only the treatment and the side effects and being proactive, but they can rest assured that the medications are done properly too. That you're not going to get a staph infection, or the medications are dosed properly. The efficacy, all these medications, they have to be tested for efficacy, making sure that they are what they are. They have to come within a very tight guideline of what it is. So these are things that you just don't have control of when you're online and buying these things. You have to see a doctor, you have to get blood work, you have to see the prescribing physician, and that's the beauty of it right there. The beauty is that for a few bucks more, you're going to be supervised, you're going to see a physician that knows what he's talking about, you're going to have a follow-up done, making sure that everything's working well, your cholesterol, your liver, your kidneys, your thyroid, your prostate, these are all looked at on a regular basis. So those are things you just don't get when you try to self-medicate yourself. The other thing is the third thing we covered: sterility, efficacy, legality. When you're buying a medication online, you're breaking the law. You have to be prescribed a medication, and if you don't have a prescription on that, depending on what kind of medication you're getting, it could be a misdemeanor. Most of these medications, you're going to get a felony. These are scheduled drugs that have to be prescribed and getting them is it's ridiculous the risk people take to save a few bucks. And you're not saving a few bucks. At the end of the day, with everything that we just covered, you're not saving much money. You need the peace of mind that you're doing something safe, legal, medically supervised, and it's really that simple. Going back to the medications, a lot of women, they're worried about testosterone and the virilization or androgenization of women, their voices getting deeper, hair growth and so forth. There are medications that are modified. Pharmacists have developed hybrids of certain medications that are appropriate for women. So women that don't have good endurance, they don't have good libido, they're not recovering well, they're not alert. Along with those things, they don't want to risk hair loss and so forth. So there is a whole line of medications that develop for women, and there's an appropriate schedule how to take them too. And women, I've seen women come in and they're prescribed everything with a doctor, but they're not taking it at the appropriate time. They're taking medications later in the day that keep them up at night, and they're taking the medications in the morning that make them tired. They don't understand why the medications don't work, and that's because they're not being supervised again. So if you're taking pregnenolone and DHEA, you want to take that during the day. It's going to keep you alert. It's going to keep you sensitive. It gives you good cognitive function along with freeing up bioavailable hormone. But if you take it at night, you're going to have, sometimes people have a hard time sleeping with high DHEA numbers in their system at night. If the doctor prescribes progesterone for you, Progesterone helps serotonin release. So guess what? You're going to relax, and that's going to free up serotonin. You don't want to be taking that first thing in the morning. You're going to be groggy all day long with a lot of patients. So that's a medication that's usually taken at night. So when taking those things, the order and the relationship of your activity level is important, because there's a certain half-life or bioavailability of some of these medications, and they're fairly short. So it's just like when we covered pre-workouts and so forth in nutrition. It's just as important that the medications are taken at the appropriate time during the day or night, in relationship to your activity level, your rest, and so forth. So, we have law enforcement and firemen that have swing shifts, and they're doing a 24-hour cycle gig, something like that. We've got to take a look at them and see what's appropriate nutritionally as well as supplementally, and with their medications, so they have best benefit and they get rest. It's important that you rest well when you're on these medications, also to potentiate the benefit from them. So your activity level, when it comes to people working out in the morning, certain medications really will wake you up, stimulate your body, and so forth. Other medications, if you're working out or training in the afternoon, or if you're sedentary, what medication should you be taking? And when it comes down to hormone replacement therapy, there is a schedule, and there is a specific plan based on your lifestyle and your activity level and your relationship to food and activity and so forth. When that is all mixed together, that's the magic. So we're eating, we're supplementing appropriately based on our activity level. So I'm going to eat it. If I'm a desk jockey, which I am during most of the day, I eat and supplement in the medications the doctor tells me this is the best, most effective way to take them. If I'm working out early in the morning, it's a different way. So those are the fine nuances that will make your therapy effective long term. So when people come to me and say, we go to this clinic and it's $199 a month, it's the same for every single patient, and within 6 months, the therapies aren't that effective anymore. And that's where we check the blood out, and we have blood density issues, we have estrogen issues, we have cortisol issues, we've got patients want to take more medication, and that's not necessarily the case. So the doctor will look at those things and say, wait a second, this guy needs to donate blood, we need to control estrogen, he's not resting. It's not the medication, it's how appropriate they're taking it. So, and then there's all kinds of conflicting information out there. So those are the basic things that I wanted to touch about today. And if you have any questions, you can contact me or email me at bob@revivehrt.com. And that's about it for today. Thanks.
Let us know anything you want to hear.
Yeah, if there's any other topics you want to get into, or anything specific, contact me, leave a message there, private message me, and I'll get back to you directly. Have a great day. Thanks.